Yeah. So good evening, everyone. Thank you, Dr. Mamta, for introducing. I hope I am audible to all of you, right?
Yes.
So today, let's come directly to the topic. We are going to talk about miasms, and I know miasm is one topic which is, I think, the most difficult topic to understand and to use it in a practice, right? In a clinical practice. I can go back, especially I can go back to my college days when I was studying homeopathy. Okay, and I was very much hooked on to organon. And at that time, there were some books which my seniors and especially my teachers gave to me. And there was few books like Robert's Sensation, right? Then Robert's Philosophy, Kant's Lesser Writings, then Kant's Philosophy. All those philosophical books I started reading, and there was a section which came up about miasms, and miasm always for me remain as a mystery. In fact, I could never understand how to really understand miasm and how to use it in practice. I hope a lot of people sitting here have the same doubt, right? If yes, you can text it in the chat box, because I'm seeing the chat box. And this session, I really want to make it more uh, conversational. Yeah, the reason is that here I'm not going to share you any case, neither I'm going to share you any, like somebody said, it's a mystery, right? Neither I'm going to share you some great wisdom, right? So that today in this 2 hours lecture you'll be master of understanding miasm. But yes, I'm going to open some avenues for you and the ardent student, whoever are ardent student of homeopathic practice, they will get a light, basically how to approach and where to go and search for it. So mystery, burning question, somebody has written it is a burning question. In fact, if you just talk like about miasm with any colleagues, okay, I used to feel, you can, maybe you can say yes or no. I used to feel, what is the need of miasm actually? A case comes, you take the totality, you give the remedy, that's it. Why do you want to understand miasm? And it is so complicated, so complicated. This is the book, this is a book that was given to me, right? Chronic Diseases by Hanneman. And of course you all must be having this book. And I really have importance that I know that a lot of people must have also gone through this book. But tell me really, how many of you really have understood what Dr. Hanneman is trying to say? For me, initially, it was really difficult to understand. So now, what is it? Um, how we are going to understand? Let's talk about that. Somebody has written, "What is the clinical importance?" Actually, this was one of my questions. That what is clinical importance of that? Right? You have so many systems. You have got sensation method. You have got predictive method. You have got ICR, IHP. So many methods, classical methods. All methods are great. You have got thematic approach. All methods teach you different avenues to reach to the totality, to the core of the patient. Then why not we just focus on the method and get the remedy and give to the patient? Why we have to think about miasms? So let me tell you how I got hooked onto it and why I started really feeling it is really important, right? As doctor, when she was introducing me, she said that I am being working on pathological cases a lot. So fortunately I have been exposed through some of my senior doctors like Dr. Sunil Masarka, Dr. Suji Chatterjee, Dr. Gajanan, Dr. Borkar, and many others. Through them I have always been exposed to solving pathological cases. And when I was graduating, this was my zeal actually, because everybody must feel the same way. In fact, when I was in my internship or in my third year, fourth year, when my homeopathy was coming out of me and I was really getting passionate about homeopathy, it was not that I saw some cold fever went off and I got motivated to practice homeopathy. I really saw great cases like deep pathological cases, difficult cases, coma, syphilitic cases, kind of, big names, difficult cases getting better and patient coming out of it. That really motivated me to come into homeopathic practice. And that was my goal actually, that I want to learn how to solve these cases, how to go about and get some good results. But when I started my practice, right, in initial, I got good experience working under different doctors. But let me tell you, I was lot many times disappointed, lot many times, because what I felt, in many cases there were lots and lots of failures, lots of failures. There were some cases where we could get miraculous results, but there were many cases where we could not understand, even after giving the right remedy, the totality and everything, the deep case taking, results were not impressive. And in my initial years of practice, I don't know why, but I saw many failures in homeopathy, especially in some cases of cancers, and all those bad cases, kind of, what do you say, incurable cases, you call it, that bracket. So this was one side of my learning, but at the same time I was also seeing that there were lot many homeopaths who were producing great results. But to my surprise, when I really started working and seeing the world, right, closely, what I realized, that every homeopath has actually got some great cases. Even I know there are so many doctors plugging here, maybe more than 100 doctors here. There might be many doctors plugging here, and many of them can share some case of brain tumor, some case of this and that, definitely. So what I understood is that results in homeopathy is actually sporadic. It is sporadic. In our clinical practice also, the results are sporadic. So there is no clear cut pattern, right? Suppose if I have treated one good case of brain tumor, I cannot vouch that the next brain tumor case comes with this method, I can produce the same results. And that was the problem that I faced, and this was my learning. And then when I moved ahead in the zeal to understand, the one thing that really happened to me, and I feel that's the best learning for my homeopathic career, is that I really got hooked on to old books. I started reading a lot of old books. In fact, at my clinic, at my home, you'll find lot many old books, and especially come in contact with Dr. Sarkar and other doctors. I understood that there is something hidden. Somebody has written hidden. There's something hidden in these literatures, and the problem is that we young doctors are not opening it. Maybe because we don't know how to open it, where to open it, and neither we have any physicians generally who's actually taking us to that journey and showing us what our masters have done. Right? My video is stuck. Is it okay now? Dr. Sejal, is my video okay now? Okay, great. So before I jump onto this, I want to understand from you. I want to understand from you that what is your idea of miasm, and basically the question which I want to put forth is that why do you think Dr. Hanneman went back and introduced this term miasm? What is your understanding? Maybe few of them can type in the chat box. Okay. Why did Dr. Hanneman, he was a great homeopath, why did he went back? You know how many years he spent to come to this discovery? Anybody has any idea how many years of research he did? Yeah, 12, yeah, 12, 14 something. Viva question. Why I remember it was my Viva question, remember, 12 years, he took 12 years to go and study all these things. And somebody has written blocks, incurable, recurrence. Yeah, very nicely somebody wrote, because recurrence of symptoms. So what happened with Dr. Hanneman was, Dr. Hanneman used to treat patients. Patient used to come. He used to take the totality. And I know he was a good doctor, right? But what do you feel? He was a good doctor? Of course, we can't question him. He was a great, he was master. He introduced homeopathy. But to his surprise, all the philosophies and whatever uh, great things he taught about homeopathy, he realized after many years of practice that the patients are coming back again and again. Maybe that uh, symptom is gone, but he's coming with another set of symptoms. I'm treating patient, but after that, when he comes back, he's more troubled. He has, his disease has progressed, or some other organ is being affected. And see, Dr. Hanneman was a master. He's not just master because he introduced homeopathy. It was because his mind was very scientific and he was a very inquisitive kind of personality. Right, right. Now I'm getting lot of answers as a block curing. Okay. So hence what he did is that he went back and he started looking at all the cases, and going back to the history, and started researching many cases, right? And then hence he realized that there are certain other understandings that we need to understand. There is something hidden in the case that we are not able to see. And he found out the three things, three problems. You can call it block, you can call it intercurrent, you can call it anything. And he gave the name miasms. And of course, I'm not going to go into the theoretical part. What is the meaning of miasm and taint and all those things that you can learn? Maybe I'm going to connect it to the practical part of it. Fundamental cause. A lot of different names came to it. And to summarize it, basically, Dr. Hanneman found out that when a patient comes to you and is showing a set of symptoms, you give X remedy. That could not be his remedy. There are many things which is behind the patient, behind. It's in the past. And that thing is not addressed. And that's the fundamental cause, or somebody has written treating from the roots. If that has to be understood, then only you can really cure the patient. I hope this summarizes the way Hanneman, looked at it. In fact, there's one more book. I'm going to show you 3-4 books that you have to read. Basically, there's another book. I'm showing you Allen's Miasm, the Chronic Miasm with Repertory by Henry Allen. This book is available on Amazon. It's a wonderful book. So when I was reading this Allen's miasm and he's talking about the miasm, basically he talks about, he says that miasm is basically, if you want to understand miasm, maybe you can, have you seen fountain? Have you seen fountain? The water comes out, fountain. Like suppose, I have this bottle, fountain, water is coming out. So when you see the water coming out, different segments water is coming out, right? All those branches where water is coming out is actually the totality of symptoms. So patients sometimes come with X, Y, where the production of the water is there, that is actually the cause, and it is called miasm. So when now if you really want to have great results or great cures, what you need to do is that we need to understand the fountain, right? And this fountain, if you understand the cause, then we are not going to be stuck on the fundamental, the branches that is coming out, right? Great. So video is stuck. I think, if your network is not proper, maybe then also video gets stuck, because I have got a Wi-Fi, so I don't think the problem should be there, right? Okay. Okay. Now my next question, before I move to the slides, tell me how to differentiate the three miasms, Sora, psychosis, syphilis, in a very simplistic way. Like a simple one word, two word, if you want to differentiate. Yeah, Sora deficiency, very good. Itch warts, ulcers, Sora inflammation, psychosis growth, Sora functional, yeah, very nice. Sora is an itch, Sora inflammation. Of course, please talk about psychosis. Psychosis, ulcers are syphilis, syphilis destruction. Okay, okay, okay. Great going. Let me share my PPT. So I hope you can see my PPT, right? Okay, okay. Psychosis axis. So let me write it down. If I want to summarize this, if I can write down functional, Sora is functional, psychosis is structural or growth. Growth, I'll run down growth, and syphilis is destruction. So am I correct? Say yes, no. Type yes, no. Yes. Okay, okay. Oh, so many yeses. I mean, it means that everybody agrees. What I am saying right now? Psychosis is excess or lacking. Okay. So now here I am. Here I have come to actually disappoint you. Okay. This classification, this was also my understanding, and this is what I learned in my college days and in my initial years of practice. But when I really read these books, the chronic disease and Hanneman's chronic disease and Allen's miasm, I realized that what we are being said, what we are being said, what we are being taught about these miasm is actually partially true. I'm not saying completely false, but it is partially true. And this can sometimes be misleading. So whatever I'm going to talk now, I want you to listen to me very carefully and take it with a pinch of salt. And whatever I'm going to talk now, I'm not going to talk anything from my brain, my theories. No. Everything I'm going to talk from Hanneman's chronic disease. Whatever Hanneman said. So if you look at this, okay, Sora's functional, syphilis. So let me ask you, when you look at this functional, growth, destruction, which is the most dangerous miasm? What do you think? Looking at this, syphilis. Somebody said, yeah, syphilis, then destruction happens. Syphilis. Oh, now a lot of people are saying Sora. Okay, syphilis. Somebody is saying psychosis. Okay, so everybody has their own favorites. No problem. Okay. If somebody looks at this, right, Sora is functional, psychosis is growth, and destruction is syphilis. First sight, it actually looks that syphilis is the most destructive. But now the next question that should come in your mind is that, then why did Hanneman set Sora to be hydra-headed, monster, multifolded? These are certain adjectives he used to describe Sora. He said Sora is multi-headed, monster, multifaceted, mother of all miasms, mother of all diseases. Am I correct? Say yes or no. Yes. Doesn't it gives you a question that if Hanneman said so many adjectives for Sora, then why are we calling syphilis the most destructive one? Doesn't these two things contradict each other? Definitely. So now From where this came? Functional growth. This who said this? Hanneman has not said in his chronic disease, even the Allen's miasm, that SORA is functional, psychosis is growth, and syphilis is destruction. Never, not even a single page he has actually mentioned specifically saying this is this. He has never. Then from where this came? As per my knowledge, I have, I might, I'm right almost, but maybe there was a guy called homeopath called Ortega. As per my study, he was a physician who saw that understanding of miasm is very confusing. When you open a book, Roberts, Kant's, even chronic disease, it's very confusing to understand. Like SORA, so many features, psychosis, so many features. It is confusing to understand. So Ortega, maybe, to simplify things, he gave these terminologies, he gave these keynotes, he called it keynotes, so that it becomes easy for understanding the homeopaths. But the problem with homeopath is that we homeopath always want easy way out. Somebody gives us something easy and then we are very happy. And that's the problem that happened, that we started looking at it. I'm not saying okay, Ortega was right or wrong. He gave his understanding. He tried to make it simple, but we got hooked onto this and we stopped reading what Hanneman said. And hence the problem started coming. So now, what am I going to do is that the first thing that I want you to understand, let's get this idea out of your mind. The first thing. And now I'll take you to the journey where I'm going to show you what Hanneman said and when to see how to understand psychosis, how to understand syphilis, right? And how to understand SORA.